So good morning, everybody, and thank you all for being here with us today. It's really, really great to have this as the first session of the Health Data Forum Global Hybrid Summit. So as you all know, the summit was supposed to be happening in these beautiful places we have in the back. So, and virtual does not mean distance, I hope.
So it's a fascinating time in Europe at the moment with a new commission and policies, especially around the European health data space and the EU for Health programme. Data sharing governance and digital literacy have an important role to play in the development of these new policies. The summit asks, how can big data empower health and healthcare for revival and renewal? This panel will start to answer that question. In my view, technology is often overpromised and under-delivered to healthcare professionals and citizens. I've seen a slide used by a couple of people that talks about the invention of the radio and how the radio was going to transform the delivery of care by healthcare professionals, just as an illustration of the point. So the question is, will digital and health data fall into the same trap of over-promising and under-delivering? The importance of data is clearly seen in the summit's agenda. There's AI, COVID, system architecture, interoperability, and EHRs on the agenda. The link to all is data and data access. At the moment, the pandemic is shining a very bright light on the use of data, analytics, and when data is not available, either in country or across borders. So as we were just speaking about before we started the panel, this opportunity presented by the pandemic, will it transform the use of health data?
Citizen secure access and sharing of health data, it is really a broader scope. And for us, it is very important that we take onwards the citizen perspective on this topic. Of course, it is very important to touch upon on the governance perspective and to see how can we identify and promote the adherence of digital technology and sharing of health data between the different stakeholders. We cannot forget an important uptake in terms to have data governance and data donation towards to have concrete data to be used between the different healthcare institutions, and of course to be reused by researchers, by public health authorities, and of course towards an innovation. In the end, we cannot do this if we don't look on the technical perspective and we follow these interoperability standards and we follow the flow of the data between the different healthcare organizations.
And that is that there are probably multiple answers to the question, because there's more than one first step to be taken. But I think there is an absolute prerequisite, which is that we are not going to be able to provide population-wide support for digital literacy without investment. And therefore, in a way, one of the very first steps has to be that agencies that have a responsibility for educating citizens, agencies that actually care about the benefits to all from more digitally literate patients, have to be ready to come up with the money. I know it sounds a bit blunt, but there are other actors, I would say, also need to be first movers, including patient organizations, educational bodies, public health bodies, many other bodies that would be closer to content or delivery, but none of them have spare budgets in their pockets today, especially in a COVID era. So we have to first decide that it's a worthy public investment, and that the people with some degree of control over budgets have to be ready to say, this is a priority. And it's not a competing financial priority with COVID. the opposite. It is actually a coping strategy for having COVID, because digitally literate patients will be better equipped to cope in a COVID era.
A step that can be done to do that is really to define what e-health competencies health professionals should have, and that should be designed in the medical curriculum and other healthcare curriculum from the first day in the medical school. Well, for me, one of the most important things is to begin with educating the professionals from very early on their career. I mean, even medical students should have a clear plan about digital health, because professionals can really be motivators for their patients to use technology and other tools. So the trust that the patients have in their doctors, nurses, or other professionals should be the motor to begin and to go on from that. The other thing is that the systems to health professionals should be born in the middle of the work and the healthcare providers. Health professionals need to understand that it's something that comes to help them and not another tool that they should add on to their clinical work in their daily routines. So the professionals should be involved since very early in all the programming, designing, and so on of all the systems, so they can really feel that is something that comes to help them, that is something that comes from real life, and this is not a battle between engineers and physicians or healthcare providers.
But I think it's an interesting point, especially if we consider this keyword of citizen-centered approach. What is citizen-centered in this content? Does citizen-centered mean the citizens should have the maximum level of decision? This would point to rather an opt-in system. Or does citizen-centered mean that the citizens in general should have the maximum benefit from the maximum amount of health data? This would point, in my opinion, more towards an opt-out option. Because, of course, if only data is contributed to a European health data space of people who consciously opt in, there surely might be some selection bias of people who are especially interested in the topic, especially well educated on the topic, living with some special conditions they want to know more about. So these are very interesting questions related to this, and I was very lucky to have these insights from our participants last week, who in the majority pronounced themselves in favor of an opt-out system where you would be a default contributor to a European health data space with your healthcare data.
Finally, maybe what we are already doing, which is to say many times similar things or connected things in several different places is already a way to move forward. But for sure, it would be good to have a broader agreement between different types of stakeholders and to have some encouragement to progress on some more formal policy and bodies, as we were discussing before.
We are becoming really a global hybrid summit. That's our goal. Yes, establishing bridge also between the US, Europe, India, and other regions in the world. It's really important because the world now is becoming a small, very small village. And if we had doubts in a few years ago what happened in China would never affect us, so check out the streets and see everybody wearing masks. And that's the reason why we need to cooperate immensely. I fully agree with your conclusions, Bleddyn, and I would like also to point out here to show up the Digital Health Europe website, which is an incredible initiative that is a living proof of how the European civil society and even the European Commission, because in the end it's the European Commission that wants to have an active civil society, I think that probably the missing element we have now is the national government. So national governments need to wake for a new reality, and that's what we here in the Health Data Forum are going to be able to offer this venue for you, civil society, researchers, practitioners. Please use our forum to extend your agenda into what needs to be done in terms of health data and our future.